Good morning, Chairman Pitts, Ranking Member Green, and other distinguished members of the subcommittee. I'm pleased to join you today to discuss the integrity and the effectiveness of the 340B drug discount program. This program allows safety net providers to purchase outpatient drugs at a discount from drug manufacturers. Specifically, the law establishes a maximum ceiling price that drug manufacturers are allowed to charge these providers. To ensure robust program integrity, the OIG has recommended numerous actions to improve this program. In response to OIG and GAO recommendations, as well as congressional action informed by those recommendations, HRSA has strengthened its oversight. But there's more that could be done to strengthen program integrity. OIG work shows some continuing challenges. These challenges affect 340B providers like community access hospitals, community health centers, critical access hospitals, and children's hospitals, as well as state Medicaid agencies and drug manufacturers. OIG's work highlights two major areas of concern. One is lack of transparency in the program, and the other is a lack of clarity in program guidance. With respect to transparency, key stakeholders are in the dark. Neither providers nor state Medicaid agencies have all the information needed to ensure the integrity of 340B transactions. OIG recommends 3 steps HRSA can take to increase transparency and ensure the program achieves its goals. The first 2 have to do with sharing ceiling prices. We recommend that HRSA share ceiling prices with providers. This will allow providers to ensure they are not being overcharged by drug manufacturers. We also recommend that HRSA share ceiling prices with state Medicaid agencies. This will allow state Medicaid agencies to ensure they're not overcharged when they reimburse 340B providers for Medicaid patients. Making this happen would require new authority from Congress. Finally, we recommend greater claims transparency. HRSA should further improve tools intended to make 340B claims transparent to Medicaid. Medicaid agencies need this information to protect drug manufacturers from providing rebates on drugs that have already received an upfront discount through the 340B program. In addition to the lack of transparency, program guidance lacks clarity, failing to keep up with the evolving and complex marketplace. One key change that's taken place over the past 5 years is the growing reliance on retail pharmacies. In retail pharmacy settings, we found that providers made different determinations on what prescriptions were eligible for the discount. Let me illustrate that with an example. Let's imagine a doctor sees a patient at a community health center. Later, that same doctor sees the same patient at her private practice. If that doctor prescribes a drug to that patient at her private practice, is that prescription eligible for the 340B discount? One provider we talked to in our study said yes. Another provider in our study said no. And yet another provider said maybe. So who's right? We couldn't tell based on current guidance. HRSA's guidance addresses patient eligibility, leaving room for interpretation as to which of a patient's prescriptions might in fact be eligible for the program. Furthermore, guidance doesn't address how to handle uninsured patients at retail pharmacies. We found that because of the way retail pharmacies operate, uninsured patients may end up paying full price for their prescriptions. We believe it is important that HRSA update program guidance to more clearly and specifically define patient eligibility, as well as address other complexities introduced by the use of retail pharmacies. Without more clarity, it is hard to determine or enforce compliance. We appreciate and share your interest in the integrity and the effectiveness of the 340B program. Towards that end, we have ongoing work in this area that we plan to issue later this year and can share with you at that time. At this time, I'm happy to be of assistance if you have any questions. Thank you.